Hi everybody, it's Dr. Molly with Birmingham Pediatrics and Campground Pediatrics. We're going to talk again today about coronavirus, COVID-19. There's been a change, as everybody knows, I'm sure, now that we have 2 cases in the Metro Detroit area, one in Wayne County and one in Oakland County. And I wanted to update you about what we're going to be doing in our practice to make some changes to keep you safe and keep our practice going during this time of change, and also give you some guidance about what you should be doing as a family to prepare and keep your family from getting sick and preventing spread to others in the community. First, I just want to reemphasize that nobody should be panicking. Even when the disease becomes widespread in our community, and it's very likely to at some point, the illness, COVID-19, is causing flu-like symptoms for most of the people it infects. It is risky for people who have significant underlying health conditions that affect their lungs, immune system, or if you're elderly. So I don't think this is going to be a big deal for children in particular. Across the world so far, children have not been very heavily affected by COVID-19. Adults, however, especially adults who are older or have underlying health conditions like diabetes or lung problems, have been significantly affected by COVID-19. For these reasons, in order to keep other people safe, I do think it's important, if you're feverish and coughing, that combination of both, you probably should stay home. You should isolate yourself from others to try to diminish spread. I purposely chose today to be in our Michigan State room because Michigan State did decide not to hold in-person classes for the next month or so. And the thought is it's because they may have a student on campus who is under investigation for having COVID-19. Because even though students that age aren't at high risk, they're likely to get mild symptoms that they could spread to others. They don't want to take the risk of any of the fragile students or faculty in the area getting sick. We have telemedicine set up, and we've had it set up for years. I'm going to advise you to go to our website and sign up ahead of time so that should you need to use our telemedicine services, your children will already be registered. In addition to telemedicine visits, I do want you to know that now every patient is going to be asked when they called about screening questions about fever and cough. And if you have fever and cough in your family, you're going to be triaged first before coming to the office. That'll ensure that our patients who are fragile won't be potentially exposed to anybody. A lot of patients are asking, well, can I get a COVID test? Well, right now, the testing is being done in direction by the health department. So unless you have significant symptoms likely to result in hospitalization, testing is not available. You won't be able to just go in anywhere and get a test done. It's only if you are significantly ill that a test can be performed. We can rule out other things if we need to, but if you're mildly ill, just have flu-like symptoms, the recommendation is just stay home, treat it like a viral illness, and weather it out. Our triage service and our telemedicine appointments should be able to help guide you in that way. Know, though, that if you do end up coming to the office, we do have all the protective equipment needed to care for your child and to prevent ourselves from getting infected and therefore prevent spread to others. It's safe to come to the office if you need to in the meantime. Again, don't panic. Know that you aren't going to be able to just get a test if you want one, but you will be able to be tested if you need one. I don't want anybody to get overly nervous. If you have a fragile child or fragile adult in your household, I do think it's important that you take more precautions, but otherwise lead a normal life. Do your normal things. This is Dr. Molly O'Shea with Birmingham Pediatrics and Campground Pediatrics.